Doctor YouTube channel. We're so glad that you joined us. My name is Karen and I'm here with the Tooth Doctor, Peter Yoo. And today we're going to be talking about what is TMD. So what is the actual name of TMD? I'm going to let you say it.
So TMD means temporal mandibular dysfunction.
All right,
Okay.
so we're going to break that down today. First I'm going to share a quote with you, and it is, "You don't have to brush all your teeth, just the ones you want to keep." Kind of a famous quote. We like to use that one.
I think they use it for flossing too, right?
Yes, they do. So an estimated 2.26 million school days and 4.15 million working days are lost annually due to dental visits or dental sick days. That's coming from a stat. Actually, that's coming from 2007 to 2009, so that number's probably changed, but yeah. So do you want to jump right into the questions, or can you think of a story that goes along with this?
I have a patient that literally struggles with her jaw joint. When she eats, she has pain.
Oh, wow.
When she talks, she has pain.
Wow.
Like, she can't do anything without having this constant pain, and so it's like chronic pain all the time.
Wow.
So yeah, it's very unfortunate. She's like, yeah, if I just keep my mouth shut, then I'll be fine.
Wow.
So
That's hard.
yes,
Not a good
very,
quality
very
life.
difficult.
Yeah. Wow. Okay, so can you break down what is TMD then? What's going on?
So TMD, basically, your skull is two parts. Got the main skull, holds the brain, other pieces, your eyes and stuff, and then you have your jaw joint. Okay, so that's the second bone, and so there's a connection. With any bone, there has to be cartilage to kind of basically cushion. You don't want bone rubbing on bone.
Mhm.
Okay, that's not good. Okay,
Yeah.
you're sports athletes
Yeah,
that
knees
they've
usually.
lost their knees or their
Yeah.
hips, and very, very difficult when you can't move joints, right?
Mhm.
Yeah.
Okay.
So TMD is basically your jaw joint is in pain from moving.
Mhm.
Yeah.
Okay. So how common is TMD?
I'd like to think that it's quite rare. It's not something that I don't see a lot. Obviously, there are some clinics that specialize in TMD and they focus on that. Depending how you look at it, I kind of wonder. TMD is where the actual joint starts to degenerate. Okay, starts to kind of crumble in a sense, and so that becomes a very serious matter, which would require surgery. But most people that I find that come in, it tends to be more of a stress, muscles,
Okay.
things like that hopefully are fixable and curable.
Yeah. That leads me to my next question. What are the causes of TMD?
One of the main causes I find is stress for your muscles. Okay, so people understand that grinding, clenching are all due to stress that we have, and so with that, you're basically causing more stress on your knees. It's like your knees.
Yeah.
How do you damage your knees? Well, if you run too much,
Mhm.
if you're moving back and forth, side to side, all that is heavy load on your knees and the cartilage that's between them.
Right.
And if you do it too much, it can get to the point where you basically damage the cartilage or damage the bone, and then you can't run anymore, right?
Yeah.
So same thing with your TMJ. If you're stressing, clenching and grinding your teeth all the time, that just creates just a lot of load on the joint there.
Okay. So how do you diagnose TMD?
How do you diagnose? Here at the Tooth Doctor, we have we assess just the simple treatment. When it gets really crazy in a sense, there are specialists that deal with electrodes and all that stuff to understand how the joints and the muscles are working. We assess it basically on just having the patient come in, doing different movements, and just kind of seeing where the pain is, how the pain is initiated, and how we can kind of alleviate that.
What are some ways that TMD can be treated at home?
trying to minimize jaw movement. Okay, so we have some patients. Some of the simple things we do is don't chew gum. Stay away from chewy foods. Cut up your meats. We talk about even just things that people do. Some people they sometimes like to sit on their bed and they kind of have their hand on their chin, and that does cause pressure. Sometimes like a side pressure, which can lead to pain. Actually, I met this one lady. She was having pain on her left side, and I was trying to figure out what's going on. What you do. Making sure you eat on both sides. I found out sounds a little silly, but actually solved the problem. But she likes to sleep on her left side.
Oh.
And I'm not sure if her pillow was too firm or something, but it's pushing on her jaw and just causing stress. And the simple solution of just sleeping on the other side, just kind of balance your head position, end up solving her TMD problem.
Yay.
Yeah.
I might have to try that tonight. What are some in-office treatments then for TMD?
We always start off with just checking the muscles, making sure that the muscles are okay. Sometimes it's when you open, sometimes it's when you close. Usually the first things that come about is grinding or clenching. And so you have to understand that your teeth, when they're together, your jaw joint is together. Okay? So if I stress on my teeth, then I'm stressing on my jaw joint. I hope that makes sense.
Yep.
Right? Because the jaw joint here and your teeth here, it's just all one piece, right? So when you're stressing on your teeth, then your jaw joint is getting pressed. Okay? And it's the cartilage that's between them. So you hear people that come in and they hear clicking or their jaw pops. People have a locked jaw. Okay, that's just showing that there's just stress. The cartilage is getting compressed. Okay, so one of the simple things that we first start off doing is a night guard. Okay, so basically a little acrylic that we place on the teeth so that when you sleep, now your teeth are actually separated. Well, what does that do? Well, that separates your jaw, right? Jaw joint, and just in the end, there's less stress on cartilage, which hopefully minimizes the deterioration, right?
Right. Okay. And how does Botox help with TMD?
Well, Botox helps. Basically, what it does is more so helps relax some of the muscles. Okay, in each muscle, let's just say there's 1,000 fibers. Okay, and so if you flex a muscle, you're using anywhere from 80, 90 to 100% of all those muscles that you use. Right? When you're not flexing a muscle, you're using possibly like 10, 20%. Right? There is still some muscle fibers that are still working, just kind of keep that muscle in, I guess to say, in check. So what Botox does is it helps to calm down and neutralize some of those muscles, which ends up neutralizing the stress on the joint. Okay? So some people, they have very big cheek muscles.
Yeah.
And so using Botox will sometimes relax, allows muscles or numb a lot of those muscles so that you're not in a kind of a constant flex mode.
Right. Yeah. And how often would you need to get Botox treatments for TMD?
Everybody varies. Varies anywhere between 4 to 6 months.
Okay.
Yeah.
Okay. And what are some unknown symptoms of TMD?
Unknown symptoms? I'm not sure what that means. Unknown symptoms. Headaches.
Yeah.
Right? People can end up getting just from talking, having headaches. Fortunately or unfortunately have not had a situation or a patient that's come in, but I've met some people where they actually show scars on the outside of the face because they actually went in and got a joint replacement.
Oh, wow.
Okay? So, just like a hip replacement or a knee replacement, you can actually get a replacement for your jaw. And so those people unfortunately can't talk for quite a while. Right?
Yeah.
So in terms of unknown symptoms, I can't necessarily say what exactly there is.
I would say headaches for sure. I know I have issues with my jaw, and I usually get the headaches from it. So, And it seems unrelated until I realize where it's coming from. So. Okay, well, thank you so much for breaking that all down for us. I hope you guys enjoyed that and learned something new. Remember to come into the Tooth Doctor here at Ellerslie, and don't forget to like the video and subscribe to the channel, and we'll see you guys on the next one. Bye.